Waking up with a stiff, aching back even after 8 hours of sleep? Here's the brutal truth. Your sleeping position could be sabotaging your spine. In fact, chiropractors say 80% of chronic back pain sufferers unknowingly sleep in positions that worsen their pain. But what if I told you that adjusting one simple thing tonight could help you wake up pain-free? Stick around, because today we're revealing 5 chiropractor-tested sleeping positions that actually relieve back pain, plus the #1 worst position you're probably using right now. And trust me, number 3 will shock you. Let's dive in. Your back will thank you. Section 1. The worst sleeping position for back pain. Let's cut straight to the biggest culprit behind morning back pain: sleeping on your stomach. Chiropractors call this the spinal twist trap, and once you understand why, you'll never want to faceplant into your pillow again. Here's the brutal breakdown. When you lie flat on your stomach, your neck and head have to rotate sideways for hours just so you can breathe. Imagine twisting a garden hose all night. That's what's happening to your cervical spine. Over time, this torques vertebrae C1, C7, pinching nerves and triggering stiffness, headaches, or even chronic neck pain. But the damage doesn't stop there. While your neck's fighting for air, your lower back is sinking into the mattress, flattening the spine's natural lumbar curve. This strains the discs between L4 and L5, the most common site for herniations. A 2022 Journal of Orthopaedic Research study tracked 500 chronic pain patients and found stomach sleepers were 3x more likely to need surgery for disc issues. But wait, why does this position feel good at first? Here's the sneaky trap. Stomach sleeping temporarily stretches tight hip flexors and quads, which can feel like relief if you sit all day. But that a moment is a lie. Over weeks, the misalignment weakens core muscles, forcing ligaments to overcompensate. The result? A vicious cycle of stiffness and pain. Pro tip, that's non-negotiable if quitting cold turkey feels impossible. We get it. Slide a thin pillow under your hips ASAP. This lifts your pelvis just enough to reduce lower back strain by 22%, per chiropractor Dr. Lena Park. But let's be real, this is a band-aid, not a cure. The hidden danger most miss, even slightly turning your head left or right while stomach sleeping adds 45 pounds of pressure to your neck joints. That's like balancing a bulldog on your spine all night. Real-life horror story. Meet Sarah, a 58-year-old teacher who slept on her stomach for 30 years. After developing degenerative disc disease, her chiropractor showed x-rays revealing 40% reduced disc space in her neck. The fix? Switching to side sleeping plus physical therapy. Bottom line, stomach sleeping is public enemy #1 for spinal health. But don't panic. We've got 5 proven positions coming up that'll help you ditch this habit for good. Up next, the #1 chiropractor-approved pose for herniated disc relief. Trust me, it's a game changer. Section 2, position #1. The recliner modified back sleeper, best for disc issues. First up, the recliner modified back sleeper, a game changer for sciatica, herniated discs, or arthritis. Chiropractors call this the gravity hack because it literally unloads spinal pressure by 40% compared to flat sleeping. Let's break down exactly how to master this pain-relieving pose. Lie flat on your back, but here's the catch. Head, shoulders, and hips must align. Imagine a straight line from your earlobe to your hip bone. If your head tilts forward, that's 15 pounds of extra strain on your neck. Use a low-profile pillow to keep your neck neutral. Place a firm pillow under your knees to lift them 15 to 30 degrees. Why firm? A squishy pillow lets your hips sink, tilting your pelvis and reversing the benefits. Dr. Emily Carter, a spinal biomechanics expert, says a foam wedge is ideal. It maintains the angle all night. Add a roll towel under your lower back. This isn't optional. The towel fills the gap between your spine and the mattress, restoring your natural lumbar curve. Skipping this? You're leaving 30% more pressure on your discs. Why it works? Elevating your knees does 2 things. First, it takes tension off the sciatic nerve by opening up space between vertebrae. Second, it mimics the spine's natural S-shape, which a UCLA study found reduces disc compression by 52% overnight. Participants in that study reported 73% less morning stiffness after just 2 weeks. Big mistake alert. Using a too soft pillow under the knees. One viewer, Mike, tried this with a down pillow and woke up with worse pain. His hips sank, twisting his SI joint. Fix it. Grab a memory foam wedge or even a folded yoga mat for DIY support. Pro tip for side sleepers. If you hate back sleeping, start with 10-minute increments while reading or watching TV. Your body needs time to adapt. Real-life win. Sarah, a nurse with a herniated L5 disc, switched to this position and cut her painkiller use by 80% in a month. I thought back sleeping was impossible. Now I wake up feeling reset, she says. Science deep dive. When you elevate your knees, your psoas muscle, the hip flexor that's tight in desk workers, relaxes. This stops it from tugging on your lumbar spine, which is key for disc healing. Pair this pose with diaphragmatic breathing to amplify the effect. Inhale deeply to expand your ribcage, which gently mobilizes stiff thoracic joints. Bottom line, this position isn't just good, it's non-negotiable if you've got disc issues. Tonight, grab that pillow, roll that towel, and let gravity do the heavy lifting. Up next, the shocking side sleeping tweak that cured one man's 10-year hip pain in a week. Don't touch that dial. Section 3. Position number 2. The fetal side sleep, best for stenosis and hip pain. Next up, the fetal side sleep, but not the tight ball you're picturing. Chiropractors warn, over-curling crushes your spine. Here's the right way to unlock relief for stenosis, hip pain, or sciatica. Lie on your side and gently pull your knees toward your chest. Stop at a 45-degree angle at the hips. Why? A tighter curl kinks your lumbar spine, pinching nerves. Think of it like folding a garden hose. Too much bend cuts off flow. Place a thick pillow between your knees, at least 4 inches thick. This isn't just for comfort. It keeps your hips stacked like building blocks, preventing pelvic tilt. Dr. Rachel Nguyen, a stenosis specialist, says, misaligned hips add 30% more pressure on spinal nerves. Hug a full-body pillow like your life depends on it. This stops your top shoulder from rolling forward, which twists your thoracic spine. No body pillow? Roll up a blanket and clutch it like a koala. Science says, this position opens spinal foraminal space by up to 18%, giving pinched nerves room to breathe. A 2023 Mayo Clinic trial found stenosis patients using this method saw a 67% drop in morning hip stiffness and 52% less nerve pain in 4 weeks. Pro tip for broad shoulders or pregnancy. Slide a second pillow under your waist to fill the gap between ribs and mattress. This stops your torso from sagging, which strains ligaments. Pregnant? This also reduces round ligament pain by 41%. Real-life win. Mark, a 62-year-old with spinal stenosis, ditched his fetal curl for this method and cut his painkiller dose by half in 10 days. I finally sleep through the night, he says. Big mistake alert. Using a flimsy pillow between your knees. One viewer, Lisa, used a flat cushion and woke up with hip bursitis flare-ups. Fix it. Grab a memory foam knee pillow. It holds shape all night. Why your shoulders hate side sleeping. Without a body pillow, your top shoulder collapses forward, jamming the rotator cuff. Over time, this can lead to frozen shoulder syndrome. Hugging a pillow keeps joints neutral, like resetting a dislocated puzzle piece. Chiropractor hack. Place a heating pad on your lower back for 10 minutes before bed. Combined with this position, it relaxes muscles 2x faster, per a 2021 Journal of Spine Medicine study. Bottom line, this isn't your grandma's fetal position. It's a precision-engineered painkiller. Master it tonight, and say goodbye to waking up feeling like the Tin Man. Up next, the controversial prone position that defies everything you've heard about stomach sleeping. You won't believe number 3. Section 4, position number 3, the prone savior for upper back pain. Shocking, right? Earlier, we trashed stomach sleeping, but this modified prone position is chiropractor-approved for upper back and neck pain. The trick? Never turn your head sideways. Lie face down with a thin pillow under your forehead, face looking down. Place a firm pillow under your chest to lift your torso slightly. Keep arms by your sides, palms up. Why it works. Elevating the chest reduces neck rotation and aligns the thoracic spine, which is the middle and upper part of your back. This alignment is crucial because it gently counteracts the forward slump that many of us develop from hours spent hunched over computers or smartphones. Think of it as a subtle, restorative stretch for your upper back. Dr. Alicia Tran, a renowned spinal specialist, notes this specific elevation can ease tension from kyphosis, hunchback posture, by a significant 38%. She emphasizes that by keeping your head perfectly neutral, looking straight down, you prevent the twisting and strain on your cervical spine, neck, that typically makes stomach sleeping so problematic. This position encourages a natural decompression of the discs in your upper back, allowing muscles that are usually tight and overworked to finally relax and lengthen. It's a targeted approach to pain relief, offering a refreshing break for the often neglected upper spine. Warning: avoid this if you have lower back issues. It's only for upper spine relief. The chest elevation can increase the arch in your lower back, potentially exacerbating existing discomfort. If you feel any strain in your lower back, discontinue immediately. This position is a powerful tool when used correctly for its intended purpose, addressing upper back and neck pain with precision. Section 5, Position Number 4, the STARFISH, best for shoulder pain. Meet the STARFISH, a back sleeper's secret weapon against shoulder impingement and general shoulder discomfort. Most side sleepers, often unknowingly, spend their nights crushing their delicate rotator cuff, leading to inflammation and persistent aches. This intelligent back sleeping position, however, strategically decompresses the shoulder joints while maintaining crucial spinal neutrality, offering a restorative haven for your upper body. To execute the STARFISH, simply lie flat on your back, extending your arms outwards at a comfortable 45-degree angle from your torso, mimicking the shape of a starfish. Crucially, your palms should face upwards. This specific arm placement allows gravity to gently pull your shoulder blades down and back, opening up the shoulder joint space and preventing the impingement that often occurs when arms are tucked too close to the body or thrown overhead. The foundation of this position's effectiveness lies in proper neck support. Use a contoured cervical pillow that cradles the natural curve of your neck, ensuring your head isn't pushed too far forward or allowed to fall too far back. This keeps your cervical spine aligned with your thoracic spine, preventing secondary neck pain that could negate the shoulder benefits. For those prone to restlessness or tossing and turning, an optional weighted blanket placed over your hips can provide gentle proprioceptive input, encouraging stillness and deeper, more consistent sleep without restricting shoulder movement. Chiropractor insight: the efficacy of the STARFISH is backed by research. A compelling 2021 study highlighted that individuals consistently adopting the STARFISH sleeping position experienced a remarkable 29% reduction in shoulder inflammation markers within just 2 weeks. This significant decrease underscores its therapeutic potential. However, a vital caveat: never lock your elbows straight. Keep a slight, natural bend in your elbows. Locking them can put unnecessary strain on the joints and, more importantly, risk nerve compression, leading to tingling or numbness in your hands. The goal is relaxation and decompression, not rigidity. By embracing the STARFISH, you're not just sleeping. You're actively engaging in a nocturnal therapy session for your shoulders, allowing them to heal and recover from the day's stresses. Section 6, Position Number 5, the log roll, for sacroiliac joint pain. Finally, the log roll, a movement hack as crucial as the sleeping position itself, particularly for anyone grappling with the often debilitating discomfort of sacroiliac, SI joint pain. Sufferers of SI joint dysfunction know this all too well. The seemingly innocuous act of rolling out of bed incorrectly can quite literally ruin your entire day before it even begins, sending sharp, shooting pain through the lower back and hips. This isn't just about how you sleep, but how you transition from sleep to activity. Here's the fix for preventing that morning agony. To execute the log roll safely and effectively, begin by lying flat on your back with your knees bent and feet flat on the mattress. This initial setup helps to neutralize your spine and engage your core. Next, and this is the critical step, engage your core muscles. Think of gently pulling your belly button toward your spine. While keeping your core engaged, roll your entire body as one cohesive unit to your side. Imagine your body is a rigid log. Your head, shoulders, torso, and hips should all move simultaneously, without any independent twisting or pivoting. This prevents the shearing forces that aggravate the SI joints. Once you are fully on your side, continue the movement by pushing yourself up to a seated position using your arms. Specifically, push off the mattress with the arm closest to the bed, while bracing with the other arm. Crucially, never twist your spine as you ascend. The power should come from your arms and a steady, stable core, keeping your back straight and aligned. Why it matters. Dr. Mark Kovacs, a distinguished spine biomechanist, unequivocally calls twisting while getting up the #1 mistake SI pain patients make. This seemingly minor twist creates immense torque on the SI joints, which are designed for stability, not rotation, leading to inflammation and pain flare-ups. By practicing the log roll, you protect these vulnerable joints from damaging rotational forces. For optimal round-the-clock relief, pair this controlled movement with side sleeping using a full-body or maternity pillow. This type of pillow, placed between your knees and extending up to support your upper body, maintains proper hip, knee, and spinal alignment throughout the night, further reducing stress on the SI joints and promoting holistic body alignment. The log roll isn't just a technique. It's a fundamental principle for safeguarding your lower back and ensuring a pain-free start to your day. Section 7. Pillow and Mattress Masterclass. Even the best sleeping position, meticulously adopted, will ultimately fail to deliver lasting relief if you're not supported by the right pillow and mattress. Think of your sleep gear as the foundation of your spinal health. Without a proper foundation, even the most perfectly constructed building will eventually crumble. Let's break down the chiropractor-approved gear that will truly revolutionize your sleep quality and spinal alignment. First, let's talk pillow height, a surprisingly critical factor that often gets overlooked. For side sleepers, the goal is to keep your head and neck in a neutral position, perfectly aligned with the rest of your spine. This requires a pillow substantial enough to fill the gap between your shoulder and your head. We recommend pillows with a loft of 4 to 6 inches. This height ensures your cervical spine isn't craning upwards or collapsing downwards. In contrast, back sleepers need a shallower incline to support the natural curve of their neck without pushing their head too far forward. An ideal pillow for back sleepers typically has a loft of 2 to 4 inches. Using a pillow that's too high or too flat can lead to persistent neck pain, headaches, and even shoulder issues. Next up, mattress firmness. This is where many people go wrong, often opting for something either too plush or too rigid. Extensive research and clinical experience consistently show that a medium-firm mattress, scoring May 7th, 10 on the firmness scale, is ideal for a staggering 89% of back pain cases. Why? A mattress that's too soft allows your hips to sink too deeply, creating an unnatural hammock effect that throws your spine out of alignment and strains your lower back. Conversely, a mattress that's too firm creates uncomfortable pressure points, particularly at your hips, shoulders, and heels, leading to discomfort and restless sleep as you constantly shift to find relief. The medium-firm sweet spot provides the perfect balance of contouring support and gentle cushioning, keeping your spine in its natural S-curve throughout the night. Here's a game changer that can amplify the benefits of any supportive mattress. Place a heated mattress pad on medium heat for about 20 minutes before you get into bed. The gentle warmth helps to relax your muscles twice as fast as simply lying down in a room temperature environment. This pre-sleep heat therapy can significantly reduce stiffness, improve circulation, and prepare your body for deep, restorative sleep. Finally, a crucial pro tip that often goes unheeded. Replace your pillows every 18 months. Pillows lose their loft, support, and hypoallergenic properties over time, becoming flattened and unsupportive. A flattened pillow is a direct threat to your spinal alignment, forcing your neck into awkward positions night after night and undermining all your efforts to achieve pain-free sleep. Investing in new pillows regularly is a small price to pay for maintaining optimal spinal health and truly waking up refreshed. Section 8. PRE Sleep Stretches, 5-minute routine. Before you hit the hay, integrating a short, targeted stretching routine can dramatically enhance the therapeutic benefits of your chosen sleeping position. Chiropractors universally agree that preparing your body for rest with gentle movements helps to release accumulated tension, improve circulation, and set the stage for truly restorative sleep. This isn't about breaking a sweat. It's about a mindful 5-minute wind-down routine designed to double your sleeping position's effectiveness by optimizing your spinal health before you even lie down. Our first stretch, the cat-cow 30 seconds, is a foundational yoga pose that's incredibly effective for mobilizing the entire spine, especially the lumbar lower region. Start on all fours, hands directly under your shoulders and knees under your hips. As you inhale, drop your belly toward the mat. Lift your chest and tailbone cow pose. As you exhale, round your spine toward the ceiling, tucking your chin and tailbone cat pose. Moving fluidly between these two positions helps to gently articulate each vertebra, releasing stiffness and improving spinal flexibility. Next, transition into child's pose, 1 minute, a wonderfully restorative stretch that provides deep relief for the lower back and hips. From all fours, sit your hips back toward your heels, extending your arms forward with your forehead resting on the mat. This pose elongates the spine, gently decompressing the lumbar discs and melting away tension that can build up from prolonged sitting or standing. It also offers a calming effect, signaling to your body and mind that it's time to unwind. Finally, the legs up the wall, 2 minutes. Pose is a game changer for reducing inflammation and promoting fluid drainage. Lie on your back with your hips close to a wall, then extend your legs straight up the wall, forming an L shape with your body. You can place a small pillow under your head for comfort. This inversion helps to drain accumulated fluid from inflamed joints in your feet and ankles, reduces swelling, and promotes venous return, leaving your legs feeling lighter and less fatigued. It's also remarkably calming for the nervous system, a perfect prelude to sleep. The efficacy of these pre-sleep stretches isn't just anecdotal. Robust study proof from a 2020 Spine Health Journal review found that incorporating a consistent pre-sleep stretching routine can lead to a remarkable 41% reduction in nocturnal back pain. This significant finding underscores the power of these simple movements. By spending just a few minutes preparing your body, you're not only enhancing the benefits of your chosen sleeping position, but actively investing in a deeper, more pain-free night's sleep, allowing your spine to truly recover and regenerate. So there you have it, 5 positions, gear tips, and stretches *** to finally beat back pain and reclaim restful sleep. Tonight, try just one of these tweaks. Your future self will thank you. Drop a comment below. Which position are you trying first? Have a horror story about stomach sleeping? Share it. If this helped you, smash that like button. It helps us reach more people in pain. Don't forget to subscribe and hit the bell. We've got a shocking video next week on why your pillow is aging you. Yes, really. Until then, sleep smart, live pain-free, and see you in the next vid.